This video is about physiotherapy for cerebral palsy for parents. Cerebral palsy is the most common cause for physical disability in children. It is a group of conditions, it's very diverse. So we can have some children who've got cerebral palsy who've got a relatively minor physical disability, and some children who've got very severe physical disability. It's also very diverse in terms of the type of physical disability that the child presents with. They may have stiff movements, they may have very floppy movements, they may have extra movements that aren't very purposeful, all of which will be difficult for the child to develop their normal motor skills. Also, because movements can be quite stereotypical, i.e. the child tends to use the same movements consistently, or they might be quite limited in range of movement, we can also see impact on the musculoskeletal system. So muscles might become a little bit shorter and joints may become quite stiff. So as a physio, what would I be expecting to do in terms of treatment for a child with cerebral palsy? Well, physio generally deals with movement. We've talked about the cerebral palsy being a condition of the development of posture and movement. So physiotherapy is absolutely key for children with cerebral palsy. We've also talked about the diverse presentations of cerebral palsy, and one of the most important things that therapists will be able to do is to assess your child and understand what the underlying impairments are and what presentations they have and what problems they have with their movement. How do they do this? Well, the key way a physiotherapist can identify the underlying problems and the impairments with cerebral palsy is by looking, is by observing how that child is moving. That will give huge clues as to what problems the child may have. And when it can be compared with typical development, it gives a framework for the physiotherapist to understand what movements might be difficult, what activity might be limited. This then will guide treatment, because if we can identify what activity is limited, this activity then can be targeted and practiced. Now, why does the activity have to be practiced? Well, again, this fits in with typical development. We don't just suddenly wake up one morning and we have movements. We have to actually practice movement to be able to learn it. If you think about a skill that you might have learnt more recently, for example driving a car, you didn't read about it or watch a video, you actually had to do it. And refining that skill was about practice. In addition to learning motor skills, learning activities and practicing them, we also talked earlier about the problem with cerebral palsy actually having an impact on the musculoskeletal system, although it started in the central nervous system. Movements are affected, and local muscles, local joints that in an area that the child is finding difficult to move can have subsequent problems, which we obviously try to avoid. So the activity that we're targeting will also aim to impact on those secondary musculoskeletal problems. So it may be that certain joints that are not going through full range, we might need to activate to encourage that to happen, or if muscles are kept in slightly shortened positions, we need to make sure that they're going through full ranges of movement. I'd like to give you a short example of what I'm talking about. The young lady in question can walk very successfully. She has no aids and she manages most surfaces and stairs, etc. But the way she walks, from our observations, we can see that she's turned in, that she has difficulty straightening her knees. So there's no point me just practicing walking. I need to target the activity that she finds difficult, and that is limited. From observation, we can see that this young lady keeps her knees flexed or bent and legs slightly turned in, which is not something we would see in typical development. When she goes to step forward with her left leg, you can see there's a more exaggerated turning in with her heel raised off the floor. Treatment is about activating or practicing what's missing for her, and that is the last part of knee extension. I'm helping her by keeping her feet down on the floor and her legs slightly turned out. She's doing it, not me. I want her to practice so she's got the possibility of learning this movement, learning something different. She's also elongating those knee flexor muscles and stopping them getting too stiff. I hope you found the video useful. If you have any questions, please do not hesitate to contact me. Thank you.